Our biggest challenges at Capital is that we have good quality equipment. We have a huge demand, but we have terrible throughput. We can't process all our inpatient and outpatient MR imaging in a timely fashion. So one of the tasks that I was tasked with a year ago was to look at solutions for using our pre-existing equipment and squeezing more productivity out of it. I had done my research at trade show RSNA, particularly spoken to colleagues, and subtle had come up in multiple conversations, especially with chiefs of MRI at academic institutions, and we gave it a shot. So I've done a lot of software implementations for radiology, and 90% of them are very painful. I think we were up and running in a day. The impact on our throughput and impact on our time when it comes to adding subtle, we actually studied this pre and post installation of the software. So we looked at exact scan times, how much time we'd saved. And on average, we were saving about 40% of our scan time per study. And that includes MSK, that includes neuro, that includes body, but our biggest impacts were in neuro and MSK. By saving that time, it helped us, number one, do more outpatients, and our inpatient wait for MR is almost zero. So we can squeeze in inpatient scans between outpatients and keep the entire institution running and not make inpatients wait 2-3 days for MRIs for their studies. So it's worked out very well for us in terms of just throughput in general. The demand is always going to be there for outpatient, but we really conquered our inpatient limitations. I can tell you that just by being able to do more outpatients, that it's paid for itself already, in less time than in less than 3 months, just by the improved operational efficiency we get from just doing more outpatients. Compared to prior installing subtle, I think our image quality in most cases is either equivalent or in some cases better. So I've noticed some increased sharpness on our 3T, especially on MSK and brain, but I think I've noticed that we don't really have a loss of image quality. The number one indicator is my radiologist, and I think none of them really have complained. I also read neuroradiology, so in my experience, I've seen some better sharpness on complicated exams like internal auditory canal exams, pituitary exams, and anything that has high spatial resolution. I've noticed that it can look a little sharper at times, and I get all that detail plus a reduction in time of scanning. Most people go into an MR not knowing what to expect unless they've had an MR before, and sometimes it could be a lone exam in a tight space, and just cutting down on that time makes a big difference to the patient. Patients who are restless, if you can scan them faster, you can get them out, you have better scan quality. There's a lot of positive patient just by reducing the scan times, especially if they have 3 exams in there and they're in the magnet for an hour, you cut that down to 40 minutes. That's a big difference. It turned out very well for us. I think that we had some pain points that settled it very well. So sales were great, technical implementation was great, and then post-market support, post-installation support was great. If you're suffering the same challenges that we do, if your scan times are crunched and you need to do more patients, subtle comes in very, very useful for those cases.